Hearing loss and deafness can result from sound exposure, heredity, or to toxic drugs, accidents, and disease or infection. Auditory pathway is capable of providing a lifetime of useful service. It is, however, fragile and subject to damage from a variety of sources. So we should know what are these things. Conductive hearing loss results from damage to outer or middle ear. Sensory neural hearing loss results from damage to the inner ear. Now, when there is the conductive hearing loss is there is interference with the efficient transfer of sound to the inner ear. The sound is not transferred to the inner ear. Conductive hearing loss is characterized by a loss in sound intensity. Voices may sound muffled, while at the same time the individual's own voice may seem quite loud. It can be caused by anything that interferes with the vibration of the eardrum or with the movement of the bones of the middle ear. Even a build-up of earwax can lead to conductive hear loss. There are different treatment options. The appropriate response depends upon cause of the problem. For example, an ENT specialist can simply remove a build-up of earwax. It should be pointed out, however, that you should never try to remove wax from your own ears. You can too easily push the wax further into the ear canal, and that can even damage your eardrum. A common cause of conductive hearing loss in children is ear infection, otitis. Other causes of conductive hearing loss are punctured eardrum or otosclerosis, a buildup of a spongy tissue around the middle ear. This can be treated through surgery. Sensory neural hearing loss is generally associated with damage to the hair cells in the inner ear. Such damage is the most common cause of hearing loss and can result from several factors, working alone or in combination. First and foremost is the noise exposure. The effect of noise-induced hearing loss may be temporary or permanent, depending upon the intensity and duration of the exposure. You can see the three pictures there. On the left side, you can see the normal stereocilia or hair bundles associated with the inner hair cells in the cochlea. The middle and right panels show noise-induced damage to hair cells. How damaged they are. Note the bent over stereocilia in the middle panel. They are just bent over. That means it is a mild damage. And the third one, that is in the extreme right panel, you can see missing and fused stereocilia, which is a severe and permanent damage. When the hair cells are damaged, their ability to participate in sound transduction is compromised. If your hair cells are completely destroyed, you will be unable to hear any sound, no matter how loud they are. Badhiryam. If the hair cells are damaged, you may still hear sounds, but the sounds will be distorted. Recall that different hair cells respond to different pitches. The pattern of hair cell damage determines which pitches are preferentially lost. So if somebody has got a difficulty in recognizing the pitch, it could even be because of their hair cell damage. No? So musical pitch, even the musical pitches, depending upon your listening capacity, typically hair cells that respond to higher pitches are lost first. One reason is that the basilar membrane vibrates more vigorously in response to higher pitches. These variations can cause the delicate stereocilia of the hair cells to be sheared off. One consequence of this damage is that it becomes more difficult to understand the higher pitched voices of women and children. It also becomes more difficult to distinguish a person's speaking voice from background noise. When you are giving music therapy in a place where there is lot of background noise, if there is a patient with this sort of difficulty, it is very difficult for them to get the full effect of your music therapy treatment. That is why I asked you to find out what type of background noise is there where you give the therapy. That is important. That is not to, it is difficult in a situation like a medical college to remove that background noise from you. You have to use that is a, we cannot do away with that noise in a place where there are a lot of people. But you should know why, what is the importance of that. It is not, the problem is, you cannot solve that problem there. But you can think about this and when you come to your own practice, when you get to your own practice in your own place, you can select a place where there is minimum background noise. In a government hospital, you cannot solve that problem. Don't think that you can solve that problem by your own. Unless there is a room specifically allotted to a music therapist, which will come only after there is a government order. No, at present there is no order like that. So no doctor or no nurse in the medical college setup can give you a room like that now at present. So what problem you had there in a busy setup, that background noise, I just wanted you to understand what is a background noise. That is a part of your training. We can't go and make that problem solved, because that is there for, as I have been there for 22 years, that had been there all the 21 years. But when you set up your own clinic, your own music therapy place, you can give a place where there is no background voice. Just as I did in Amrita Hospital, we had a room there, a specific room for this alone, without any background noise. Then you get the maximum result. It's only just the way you learn these things by experience only. The effects of noise-induced hearing loss may be temporary or permanent, depending on the intensity and duration of the exposure. Although a person's hearing may recover from temporary slight damage to the hair cells, or the complete loss of hair cells is irreversible in humans. Reptiles and birds are able to regenerate hair cells. However, I don't know, this is not possible as long as, just as of now, it has not been found in human beings. Now the phrase too loud, too long, too close summarizes the cause of noise-induced hearing loss. If the intensity, the duration and the proximity of the sound to the listener, see, if it's a highly intense sound, loud, intense sound, a very long duration, and that is very near to the listener, these three things determine whether or not the damage occurs, and if that damage is reversible or permanent. So these are the three things that you have to think about. It should not be too loud, it should not be for a long duration, and should be away from you. Hearing loss can result from a single loud noise event, such as an explosion. A bomb explodes, but more commonly results from repeated exposure to less intense sounds that are very close by, as in a factory situation, like that. Then aging can produce damage. This is because of a combination of factors. Noise exposure for a prolonged period. You have lived so long, no? Injury, the heredity, illness, circulation problems, all these can be there. The noise exposure sometimes will take years before their damaging effects are noticeable. Hearing loss often begins when a person is in his or his 20s even, though it may not be noticed until the person is in his or her 50s. Not surprisingly, the greater the noise exposure over a lifetime, the greater the hearing loss, because the hearing cells at the base of the cochlea wear out before those at the apex. The higher pitches are lost first, followed by the lower ones. Then the other reason is the ototoxic drugs. Several chemicals are poisonous. Now they destroy, especially certain antibiotics destroy the hair cells, and there are several other drugs that we will just leave away. That there are certain medications which produce an unwanted side effect of tinnitus or ringing in the ears. One such drug is aspirin. Very common thing. The aspirin takers, arthritis sufferers who take aspirin for a long time, sometimes they start experiencing tinnitus and hearing loss as a side effect. Fortunately, the effect is temporary and the tinnitus tends to disappear when you discontinue the aspirin use. Then there are a lot of infections. You call it otitis. Otitis It may be either in the exterior or in the, more common is the medial part, otitis media, used due to various bacterial and other infections, and antibiotics are effective for such things. Young children especially have this problem. Then otosclerosis. Bones in the middle ear are damaged by buildup of a spongy bone-like tissue, so that the sound reaching the ear is reduced by as much as 30 to 60 dB. This has to be treated surgically. All parts of the ossicular chain has to be replaced with an artificial one. Then there is Meniere's disease, which affects the inner ear and vestibular system. In this, the organ of Corti becomes swollen, leading to a loss of hearing that comes and goes. Other symptoms are tinnitus, episodes of vertigo, dizziness, and imbalance. Disease can exist in mild or severe forms. Unfortunately, the cause of the disease is not well understood, and effective treatments are still lacking. Young children who experience ear infections accompanied by hearing loss for prolonged periods may also exhibit delayed speech development. So, as I said earlier, the bhasha, language, speech and shruti are always integrated. Then the heredity, the genetic contributions to hearing. Then there are several syndromes described for this, and we will just leave alone all those things. Then cochlear implant. It's a hearing device designed to bypass absent or damaged hair cells. Cochlear implant is a very small, complex electronic device that can help provide an interpretable stimulus to a person who is profoundly deaf or severely hard of hearing. The implant is surgically placed under the skin behind the ear and consists of 4 basic parts. Probably you have heard of the Sruthitharamgam, which was recently started in the Calicut Medical College for giving cochlear implants to a specified number of children who are affected by this sort of illness. And you know, it was flagged off by none other than K J Yesudas. So probably you have heard of that, because a musician was also involved in that, no? Now, what are the 4 basic parts? A microphone that picks up sound from the environment. A speech processor that selects and arranges sounds picked up by the microphone. You can see that in the picture. A transmitter and a receiver stimulator that receives signals from the speech processor and converts them into electrical impulses. And electrodes that collect the impulses from the stimulator and send them to the brain. See that picture there? The microphone connected to the speech processor, then a transmitter and receiver stimulator, then the electrical impulse are through the electrodes, which collect the electrical impulses from the stimulator and then sending them to the brain. That is the chain. This is the cochlear, what you call the cochlear implant, the Sruthitharamgam. Okay. Now, it does not restore or create normal hearing, one thing. Instead, under appropriate conditions, it can give a deaf or severely hard of hearing person a useful auditory understanding of the environment.